On today's World Insight, a spike of COVID-19 cases in Beijing under control, the China CDC says. What are the key takeaways in preventing and preparing for a second wave?
What does it say about this outbreak here in Beijing?
The outbreak is already contained.
Quick mass coronavirus testing and contact tracing saved the day in curbing a sudden coronavirus spread. How a private frontline healthcare provider steps up to the challenge, testing tens of thousands in a day.
A lot of customers, but afterwards we reduce in half.
And opposition to the US bill on China's Xinjiang Uygur Autonomous Region. What's the stink over a drop of ink? Here is our host, Tian Wei.
Hello and welcome to World Insight from Beijing. I'm Tian Wei. Are the clusters of outbreaks in Beijing being contained? The recent outbreak of COVID-19 in Beijing has sent jitters to the public. The city has raised a level 2 emergency response. That means tighter mobility controls have been reinstated in all communities across the city, and schools are closed from Wednesday. But Beijing did take measures to ensure the stable supply of essential goods. So what's the prognosis for the city's new infection clusters, the likely source of the new wave of cases? Has the recent outbreaks been contained? We got the direct answer from Professor Wu Zunyou, the chief epidemiologist of the Chinese Center for Disease Control and Prevention. And here is the science behind the latest outbreak in Beijing when I was talking to him earlier today. 31, 21, those are the confirmed cases over the past 3 days. What is this telling us?
So what you just said is based on the date of diagnosis. This one is based on onset of illness. It gives you more precise understanding of true epidemic.
Ah, so this is the June the 13th. This is the most impressive we have here, number.
Right. I think that the epidemic peaked here is most of people had symptoms here, the first time have symptoms. That means they have a common exposed to one single source.
I see. The blue part is the confirmed cases, and also this yellow part is more about positive testing.
That's correct. They have a certain proportion of cases tested positive. That means they actively screening, identify cases in the early stage.
And when we look at the trend, it seems quite clear.
So that indicates the epidemic contained.
Good news. If you look at Beijing, the history of, there we go, yeah.
Right, I think look at overall epidemic curve. So the first in January and February, the epidemic peaked in February, then going down, almost stopped completely transmission. So we have about almost 2 months, no single case reported. Even now the epidemic, a small jump here is not as significant. So the epidemic, now it's in the Beijing, they have successfully controlled now.
I see. What about the overall in the country?
Look at the big picture of epidemic in China. So the epidemic peaked in February. We have one single day, big jump. That yes. Because they have accumulated large number of cases, cannot be diagnosed based on laboratory. It's a big based on clinical diagnosis. They have big jump. So that solves the previous accumulated cases.
That's February the 12th.
Right.
And then we have almost the flatten out. And here is really small number right. until today.
That's correct. So look at the number of cases. So based on the early February, China almost stopped domestic transmission. We have sporadic cases imported, does not generate the big epidemic. It's only sporadic cases with very small cluster. Even in the Beijing, look at China overall, that small number does not create the national spreading. So it's a very good news now.
Professor Wu Zunyou, Chief Epidemiologist from China CDC. What a pleasure seeing you, sir.
Nice to meet you.
So you said 4 days ago that the numbers coming out over the next 3 days are going to be essential. So let's look at the numbers. 31, 21. What does it say about this outbreak here in Beijing?
The outbreak already contained. The number indicates most likely they are previously infected, not newly infected. So most of the cases actually infected before June 12th. They identified in the past 3 days.
Interesting when you say happened before June the 12th. With what kind of scientific evidence would you be able to make that judgment?
So the first, I think the most important, it's the Xinjiang market was closed and alert immediately sent out, and they quickly identify people already infected. That stopped secondary transmission. So most of the people newly identified in the past 3 days, they are most likely infected before the market was closed.
But what would you let you to reach that conclusion? I mean, can you tell from the symptom that they were infected days ago? Can you tell from the strain of virus that you found in these patients that they were infected days ago? How should we know that it is now the second round and the third round as a result of the earlier first round related to Xinjiang?
I think it's based on basic epidemiological understanding, the transmission dynamic.
Tell me more about that.
Okay, so if the epidemic continue to spread, then the number will continue to increase. And also the number they need generation. Each of generation interval, it's about average of incubation period, 3 to 5 days. So the number does not continue to increase. That suggests the number, it's the one common exposure. They do not have secondary or the tertiary transmission. So that give us confidence the epidemic is contained now.
Are you worried that there will be future cases? As you said, that there might be 3 to 5 days, and as we know, in certain cases, the days could be even more than 3 to 5. So are you worried about there could be a possibility of the second round, or not at all?
I did not think that way, because with not just based on the epidemiological data, we also look at the big environment, particularly the response. So response in the Beijing city is rigorous and timely. So the quickly isolation or identification of cases, and identify close contact, all these measures are very powerful and effective. So combine all of this together, we could make that assessment.
Are we going to see more clusters and communities likely to be alerted? Because now we see the list in Beijing is getting ever longer. It is spreading to almost all of the districts and counties here in Beijing. So in the next few days, are we going to see that further being enlarged, that list, despite the fact that you said it's already being contained?
So the number of districts will maybe a little bit more to increase, will be not large. So my understanding, the epidemic now is contained. The number of cases identified will not be increased in the next few days.
What's it like for you? I mean, Professor Wu, you were there day one for this outbreak, cluster of outbreak in Beijing. I could tell from the way your facial expression was. You were extremely worried together with many other experts. Now, as you said, it's been contained. But how would you reflect back about the past few days? You know, finally, but still, just a few days' time, it's like a roller coaster almost.
Beijing already had almost 60 days, no newly reported cases, suddenly comes with such a number of cases. That's surprised us. And we are also very lucky, Beijing, they responded very, very quickly. When the first cases are diagnosed and reported, they immediately and identified Xinjiang market as a potential source for the outbreak. Then they quickly do the screening and identify more cases, then take action to close the market and alert the community. That response is very, very effective to control the epidemic. If they take a few days later, the outbreak will be much unexpected. It's out of control.
Some were even suggesting that if things continue as it is without immediate actions against the spreading of the virus, within a week or 10 days, Beijing could be another Wuhan.
That's possible.
That is possible.
Yes.
Professor Wu, Beijing is already the center of China. More protective measures have been taken in this place than any other place around this country, I would say. So if Beijing this time be able to contain it, does it mean the rest of the country will be able to do that if similar things happened?
I believe it is true, particularly if we look back. So in the earlier this year, then the outbreak took place in Wuhan. So the cases migrate or move from Hubei to their hometown. So look at other city provinces, excluding Hubei. No single province had a total case over 2,000. So that means after cases move to other provinces, then they take an effective response to contain the epidemic. So based on that experience, if any newly sporadic cases occurred in each of city or provinces, they are ready to contain.
What do we know now, Professor Wu, of this virus? We know it might be coming from a strain so-called originally from Europe. We also know that this time it is different from the one that we discovered in Wuhan. We also know it spreads fast, but for now, not many are severely ill, mainly minor symptoms. Are these fundamental characteristics of the strain of virus we have discovered in Xinjiang, or are there other important characteristics of this strain of virus, Professor?
That's very interesting and very important. So when the epidemic takes place, we also ask a question ourselves, how the virus brought to Xinjiang? It's another spillover. So we look at the virus strain and compare that with the already identified. The virus sequence clearly indicate is different from previous spread in the Wuhan, in Beijing. It indicates the virus is coming from a European circulate. It could be coming directly from other countries. It may also come from domestic other places that with imported cases. So it clearly is not another spillover. It is coming from outside of Beijing.
Are you trying to blame the European countries?
No. No, I'm just saying the virus does not have a broad, and the circulate is coming in the different countries. Even in the China, in the later April or in the May, the major circulate is the European strain. It's not the strain occurred in the early in the January or February in China.
And you're also trying to say it is not a new animal jump.
Yes. No.
That's very
not.
Important.
Yes. So it clearly is already circulated in the world, in the, many different parts of the global. So it's not jumping from animal species to human. No.
You are personally involved in this research-related investigation team. established by the China CDC and China Health Commission with the Beijing municipal government. Tell me about the direction of your research. What are some of the most important hypotheses you're all looking at the same time?
So now we have a joint team. So we have two different categories. One is a public health response team. That is make the epidemiological investigation, try to identify close contactor, then to have them quarantined, making sure the epidemic contained. We have another team, scientific research. Scientific research try to address scientific questions. So we have two hypotheses for this. Two scientific questions. First question, how the virus brought to the Xinjiang market? It could be by contaminated products imported, could be by human. That could be employee or vendor working in the seafood market. They may, like after reopen, they coming from the epidemic area, coming back to Beijing, brought the virus to the market.
Customers.
Yes, or customers. So there are three directions we are on the investigation, try to create a linkage, the possible source brought virus to Xinjiang market. The second scientific question, how could seafood market, that seafood vendor area become epidemic center or become possible source to spread virus? How that be formed? How could that be created? Given that small environment, we try to understand.
If we look at the sheer number, 31, 21, altogether, yes, more than 100, but if you look at, just one of those states in the United States, Arizona, for example, every day, more than 1,000 confirmed cases already lining up. Why people, though, are paying so much attention to what is happening now in Beijing, which is a cluster of outbreak? Why is this study so significant?
I think it's very important. People worry about is this second wave, a big epidemic. That's one people interested. The second, can Beijing contain the epidemic? So that two question people are curious, and I think again the action Beijing City take, it has approved the epidemic could be controlled in the Beijing in China. I think most important in Beijing's case, they take action earlier, does not allow the virus spread in the community. So if you look at early cases, over 80% pointed to one single source. That means the virus is only occurred around that area. People working there, people visit there. So if we look at the data, so previous epidemic, or in the past few months, the epidemic have two clusters. One is a family cluster, another is a hospital-based or clinical-based cluster. So look at the Beijing case. We did not observe major family cluster or hospital setting cluster, and no community cases. That means we identify epidemic in the very early stage, and we respond timely and promptly and effectively.
So what Beijing is experiencing right now be a case study for all the other countries and all the other economies who managed to partially survive the first stage?
It could be possible. So in the future, it's very hard to predict, and we will expect sporadic cases could be occurred in any of city or places in the future.
We see already outbreaks in Beijing, the capital of China, Seoul, the capital of South Korea, Tokyo earlier, the capital of Japan. Northeast Asia being considered as having early success for dealing with the first round of COVID-19, but now all suffering from clusters of outbreaks in mega cities. Now, some say this is really a dangerous trend. Your take?
I think the most important for the respiratory disease, it's related to the population density. So the crowded area, they're more likely to have the outbreak for the respiratory diseases, and also the frequency of movement of people. So no movement, no spread, no outbreak. When you have faster movement, then the virus could spread very fast. So the big city, mega city, will be hot places for epidemic like COVID-19.
So this is
right.
Literally. Thank you, Professor Wu Zhenyu, for sharing your insights and also your knowledge with us.
Thank you.
And you're watching World Insight, coming up in our program today.
Quick mass coronavirus testing and contact tracing saved the day in curbing a sudden coronavirus spread. How a private frontline healthcare provider steps up to the challenge of testing hundreds of thousands in a day, right after the break.
Welcome back. You're watching World Insight. I'm Tian Wei. Aggressive testing is the key to contain the latest outbreak in Beijing. The city has carried out PCR tests on around 700,000 people over the past few days as part of the efforts to contain the resurgence of COVID-19 cases. How well has the city provided frontline health services? How can health institutions help win the battle against spikes in COVID-19 cases? Li Zhang, who is the chairman of the Icon Healthcare Group, are providing his part of the answers. He and his colleague has been supporting this citywide campaign for aggressive testing. There has to be a procedure when people come in to seek medical help.
Yeah, the major changes after COVID-19 is basically when people come to our center, first they need to measure temperature.
Yeah.
When temperature is normal, we actually, the first stop of the service, come to this room to do CT scan.
Okay.
We have to make sure, the lungs are normal. Sometimes they don't have any symptom.
Yeah.
So we have to make sure the person does not carry any virus.
So I would assume in the ordinary days, this could be a very busy place.
It is. So this is first stop, and afterwards, basically, we reduce our traffic. And before this outbreak, we actually have a lot of visit come to this place, a lot of customers. But afterwards, we reduce into half.
Okay.
Also keep a social distance.
Tell me more about how you and your colleagues have been providing your service for the general aggressive testing that is going on now in Beijing.
As you know, this just happened about a week ago. Less than a week ago, suddenly, we found some new coronavirus patients in Beijing. This is really unexpected. So before this, we actually involved in the testing in Wuhan. And in May, basically, the government in Wuhan will test everybody, 10 million people in 10 days. It's really, really huge task. So we sent actually 300 nurses from 9 cities to Wuhan. Also, we have 350 nurses, medical professionals on site. So 650 people. We participate this test in Wuhan. We basically do the sample taking for about 250,000 people in Wuhan. So we started in Wuhan. So when this happened in Beijing, we actually are well prepared. We have 5 centers already ready to take samples, for people make reservation with us. Also government, work with us. They want us to send our nurses to work with them, to help them to basically do testing for those most serious places.
I know you and your colleagues have been working very hard over the past few days, in fact, to get a few 100,000 even tested. Tell me more about the latest number and how you've been able to get it done within just a few days' time.
Yeah, there's 2 steps. One step is taking sample, and right now the standard is taking the throat swab specimen, and then we take the sample, send it to the central labs. And in Beijing, the city government basically authorized like close to 100 centers or hospitals can do on-site testing. And then there's a lot of audit, also on-site sample taking place stations. And right now, I believe there are more than 100 teams working on ground at different places in Beijing taking samples. Then they send to the central labs. The problem is right now, Beijing is not prepared for such large volume testing. Based on my guess, we start with only maybe about 50,000 to 80,000 testing capacity a day. But right now, I think the demand is more than, my guess is like more than 200,000 a day. So all the lab centers actually, they build up their capacity, they bring in more machines, also get more test kits to Beijing. But this all happened in a couple of days.
How would you handle this flood of people? They all want to have your service, and certainly this is the best time to provide service to them.
Yeah, it is really urgent task, and we start actually set up an information system. When the test started in Wuhan, the same problem is actually people start to take sample, use traditional paper, tracking system. Then we found that the bigger problems actually match the data, input data onto the information system. Yeah. So in Beijing, we started with actually everything automated system. So when we take the data, information or sample, we should be able to send it directly to the central lab. The data will go into their system directly. Right. Otherwise, it will be disaster to match the data.
On the other hand, the accuracy of the test. Now, you are the very first place where the accuracy has to be guaranteed, and then before getting it to the central lab, how to guarantee it will be the right sample?
Yeah, it's a very good question, and it's a problem around the world, because for patients infected by COVID-19, most of the virus in the lung, but we cannot go inside of lung for for usual cases. Usually, so they take sample from throat, and within throat, the organ was made, actually they always throw out the spirit. So that's the problem. So it's a very good question, and I think first the throat swab have to meet quality, and that sometimes could be issue. So that could be first place could go wrong. Second, if the nurses are not well trained, then when the nurse takes the sample, if not correctly, that could be another problem. And thirdly, and you have to store the sample properly and transport to the, also properly. Right. And right now, because the needs are really huge, and at this point, I think everybody also surprised bring everything into Beijing, but it could be an issue. Right. So that's why right now there's a backlog for testing. And even, I think for all Beijing hospital centers, they are behind the schedule to deliver tests.
When we face things like this, it really brings us a lot of more thoughts about what really happened. We have already the outbreak in Wuhan, and China has enjoyed quite a successful story in terms of how to prevent and control so far, until the latest outbreak in Beijing. We didn't know much about the virus, to tell the truth. Yeah. And now we see another aspect of the virus. So what does it say to health institutions like yours about prevention and control under this new normal, so to speak?
Yeah, it is like a tough task, and when SARS happened, at some point disappeared. And right now, I think everybody, waiting for vaccine. If we have the vaccine, effective vaccine, this will solve all the problems. Yeah. But right now, we still have to wait. There are several teams from China right now, they're working really hard. Yeah. And so there's some good sign from early stage of clinical trials, but we still have to wait until the whole thing is finished, or the clinical trial.
On the other hand, how should we understand the talk in some countries that the reason why the numbers are high is because their testing are good? How do you see comments like that, usually coming from politicians?
Yeah, I lived in the US for 7 years, and we know why this situation happens. Actually, all the equipment we are using in China, actually it's no difference from the equipment we're using in the US as a countries. Yes. And also this reagent, test reagent in this country, in China, also export to other countries. They also get emergency approval by FDA in the US as well. So I don't think much difference, and not much difference. I think just for Chinese government, when the situation really, happened, I think they will take very strict measure. Right. I think that's a major difference. I see why the number different.
Tell me more about how you, as someone who's running such a huge health institution countrywide and even beyond, dealing with current challenges of the economy while at the same time prevention and control measures.
It is like a very difficult task. I think, especially for the leaders of each country, how to balance. And I think so far, because this is global problem right now, it's a pandemic. Even one country solve the problem, want to solve the global problem. Unless this is solved globally, the economy won't come back. Each country lives depending on other countries. So I think the leaders from around the world have to work together to solve the problem together. Otherwise, I think this will going to drag on more than what we expected.
China now is talking about its reform in a lot of areas, including in the health sector. Now, based on what we know about COVID-19 and the recent experience that we had in Wuhan and now in Beijing, what would be your suggestions?
After 2003 starts in China, actually Chinese CDC built a system. This system able to reach every corner of this country. The problem is people still have to manually input the data. And when this happens, you cannot do real time. Also, if there's some situation happen, the data are not inputted, you're not able to find the problem. The good thing about China, in most of the hospital, major hospital owned by government, and they're using this health information system, we call HIS system, are supplied, I think, less than 10 major providers in China. So what does that mean? Which means it's very easy. If we're able to link the system together, take the big data, not the individual patient's data, the big data, we are able to actually find out some city has a surge of lung infection right away. We don't need to build a new system. We just need to link up the system. And we're able to do this, achieve this, without a violation of personal privacy. And China have advantage to do this. And this time, when you do the, I think Chinese government use a self-tracking to make sure people infected, if anybody get close to the people infected, people get alerted. I think it's really helpful to able to, identify people at risk.
Right. Another thing about testing is, how do you think in the future this industry will become? If we still have 1 to 2 years time before vaccine comes into being, is this going to be the focus of investment for the future? Is it going to be worthwhile? Is it going to be overcrowded eventually?
Right now, I think for the public health sector is under-invested. And most of the money go to patient cure, cure patient cancer treatment. But for the public health, not much. And I believe, AI, big data, plus some testing, new test technology, can solve certain problems. And I'm sure, for the next few years, there'll be, investment go to those sectors. And like, for example, the problem, especially with pandemic, the problem is like, when those virus infection happen, unfortunately, we don't know how serious it is until certain people get infected. Then we know how quickly, how bad the situation. Right. And for this time, what happened, with COVID-19, I believe no one would expect it at such huge, impact scale. No one expected. I think no one, no matter how smart the person is, no one would expect it. And even, in the US, when the situation already gets so serious in China, they know exactly what's happening, but they waited almost for one or 2 months. Because I don't think they expected, I think they assumed their system able to contain, can cope with, but ends up actually you can't. I think that's a problem. So if we have this AI, big data, sensitive enough, then I think this could change in some way. But it's still, we have to work with the government, also work with people, because people want freedom. Everybody wants freedom. Right. Don't want to get locked up.
So do you think your industry will have a better future despite of the current difficulties and challenges? Is this the best time for your industry to thrive?
For ICON, we actually are in some way in the prevention care side. We do like body screening, health checkup each year. We help people find illness, especially for cancer. In China, roughly, you have 3 new cancer patients for 1,000 people each year, and this number is still going up. And so this is unfortunate. Unless we change our lifestyle, also, make sure the food safety, also take more preventive cares, take more measures for preventive cares, then this is not going down. And so that's what we do. But right now, I think major issues people worry about virus, worry about other infections. So we also have to adjust to see what we can do to help people.
Lee, always a pleasure seeing you. Thank you so much for sharing your insights with us.
Yeah, thank you for having me.
China's Foreign Ministry has condemned the signing of the U.S. so-called the 2020 Uyghur Human Rights Policy Act. It says the legislation deliberately slanders the human rights situation in Xinjiang and its interference in China's internal affairs. The ministry says the core of the Xinjiang issue concerns fighting both terrorism and secession. After 1.5 years of legislative process, on Wednesday evening, U.S. President Donald Trump signed the bill which sanctions China regarding its policies in the Xinjiang Uyghur Autonomous Region. About the Uyghur issue, I'm joined by Victor Gao, Chair Professor from Soochow University. Chinese State Councilor Yang Jiechi in Hawaii just talked to the U.S. Secretary of State Pompeo. According to the press release and information related to the meeting, there seems to be an opportunity also for Mr. Yang to talk about the Xinjiang Uyghur issue with his American counterpart. Now, the question really is, Mr. Gao, what will be the nature of the issue of Xinjiang in the relationship between these 2 countries, China and the United States? Should that be an issue?
Well, the meeting between Mr. Yang Jiechi of China and Michael Pompeo of the United States in Hawaii is very, very important. For quite some time, the leaders of the 2 countries have not been talking with each other. And this is bad for China, this is bad for the United States, this is also bad for the whole world, for China and the United States. More dialogue, more discussions, more negotiations there are, the better for the 2 countries, as well as for world peace and stability. Very unfortunately, in the middle of this very important diplomatic discussion in Hawaii between Mr. Yang Jiechi and Mr. Michael Pompeo, President Donald Trump stole the blow and signed this bill into act, constituting a blatant and very serious violation of China's sovereignty. And timing cannot be worse. And I think this leaves Mr. Yang Jiechi with no other option but to condemn the U.S. action, to condemn the U.S. interference in China's sovereignty, and to reiterate the whole Chinese people and Chinese government's determination of fighting against the 3 evils and to bring stability and peace and unity to people of all ethnic groups in Xinjiang.
And Mr. Gao, tell me more about your analysis of the strong reaction from the Chinese Foreign Ministry regarding the U.S. President signing into act about Xinjiang Uyghur issue from China.
The Chinese Foreign Ministry has strongly condemned President Donald Trump's signing into law this Uyghur Act. And this is a blatant violation of China's sovereignty, and this has created a lot of indignation among the Chinese people against this very wrongful act by the United States. And this is not going to help the situation in Xinjiang. We know that Xinjiang is bordering with 8 foreign countries, including Afghanistan, where the war launched by the United States has been raging on for almost 20 years. And the spillover of terrorism, extremism into Xinjiang is, for the record, everyone with the decency of mind can have a look and come to his or her own conclusion. And China has the sovereign right in maintaining its sovereignty and territorial integrity and in fighting terrorism, extremism, as well as separatism. This is the mega trend in China, and whatever the United States is doing cannot distract the Chinese people from this very important mission of fighting against the 3 evils in Xinjiang.
Mr. Gao, final question. As the U.S. election has already begun, we all over the world have felt its effect. Everything become a political game and a political tool. In that regard, how calm should China be when the other side is trying to provoke and try to bring China as the football in their internal political game?
Well, I think as far as China is concerned, China needs to maintain its stability, keep calm, refuse to be agitated. And I think the whole world has witnessed lots of ups and downs in the United States, and the credibility of the U.S. government under President Donald Trump is being more and more withered. And eventually, I think the whole so-called leadership of the United States is being undermined, not from outside, but really from the inside, and very much from the very top of the U.S. government. I think the situation in the United States probably will be even worse or more turbulent between now and the election day in November, or even till January the 20th, 2021. And I think we should be on full alert as to the turbulence and the instability and uncertainty coming out from the United States, especially from the White House. Right. This is unfortunate, but this is life in the United States.
Victor Gao, Chair Professor of Soochow University, thank you so much.
Thank you for having me.
And that's all the time we have for today. If you'd like to see more, you can certainly search World Insight or check out our YouTube channel. Follow us on Twitter and Facebook accounts. I'm Tian Wei. On behalf of the team, thanks for watching. Bye for now.